Jason Lindo is an associate professor of economics at Texas A&M University, a research associate of the National Bureau of Economic Research, and a research fellow of the Institute for the Study of Labor, and he joins us today to share his analysis of how expanded access to LARCs through the Colorado Family Planning Initiative affected teen birth rates. Jason?
Thanks so much for having me. I think as the previous presentations have highlighted, these are really exciting times with respect to the things that can be done to reduce unintended pregnancies. I'm going to talk more about just how much we might be able to expect long-acting reversible contraceptives to do so. But before I dive in, I'd like to mention that the content of this talk is based on joint work with Annalisa Packham. Also, I'd like to briefly take a step back and highlight why I think teen childbearing is viewed as a major social problem in the U.S., because I think those who work in this area often take this for granted, whereas a lot of folks might not be aware of the relevant statistics, some of which have already been brought up in the prior presentations. As folks mentioned before, U.S. pregnancy rates and teen childbearing rates are very high in the global context. I think this is especially concerning in light of the fact that 3/4 of teen births were unintended at conception, and half of these were to teens who were using some form of contraception. It's also important, I think, to keep in mind that we have several types of policies that we could implement in an effort to reduce unintended pregnancies, many of which have been discussed in the earlier presentations. And I think the important role that researchers like myself can play in the policymaking process is in providing credible estimates about just how much these different types of policies can impact the types of outcomes that we're interested in, like teen childbearing, STIs, and abortions. And there has been a great deal of research along these lines. My read of this literature is that policies focusing on delaying or reducing the frequency of sexual intercourse have usually not been that effective in reducing teen pregnancies, but policies focusing on improving contraceptive use have been shown to be effective in the past. That being said, most of the research focuses on oral contraceptives, and advancements in LARC technology offer us some exciting new opportunities. Highlighting this new opportunity, the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics have stated that these LARCs should be first-line recommendations for adolescents. And a recent brief by the CDC highlighted that very few teens on birth control are using the most effective types, here referring to LARCs. The reason there's so much enthusiasm for LARCs is because they're highly effective at preventing pregnancy. Only 1 in 1,000 women using a LARC is expected to become pregnant within a year, versus 91 in 1,000 using oral contraceptives and 180 in 1,000 using condoms as their primary form of contraceptive. So this makes it obvious, I think, that greater use of LARCs can reduce unintended teen pregnancies. How much depends on what teens would be using otherwise. And so this is an important point that I think is sometimes lost, but if we were to get teens to use LARCs who would otherwise be using oral contraceptives, that certainly could have large effects on unintended pregnancies. That being said, we would expect a policy that gets teens to use LARCs who would otherwise be using condoms as their primary form of contraception to have larger effects. And we could get really, really huge effects potentially if we were able to get sexually active teens who would otherwise use no form of contraception to use these highly effective methods. And so the other thing I want to highlight with this discussion is that there are a wide range of effects that are possible when we think about expanding access to LARCs. And this makes it important for research to investigate what effects can actually be achieved in practice. And so naturally, the work that's been done with the Colorado Family Planning Initiative provides us a really nice opportunity to investigate this issue because of its extremely large scope. And as Dr. Wolk pointed out, we've seen Colorado's teen birth rate decline dramatically since this initiative began. I think I think in order to gauge how much this sort of policy might be expected to reduce teen birth rates if it were to be implemented elsewhere, we need to know how much of this decline that we've seen in Colorado should be attributed to the initiative. Okay, and so that's the basis of our research and the motivation for our research in this area, in which we are evaluating the causal effect of the Colorado Family Planning Initiative. And so to evaluate the causal effect of the initiative, we have to estimate what would have happened in Colorado in counties with clinics receiving funding in the absence of the initiative. And we take several approaches to doing this, and they all lead to similar estimates, which is, of course, reassuring. The most straightforward approach that we take is to consider what happened to teen birth rates in other U.S. counties with Title X clinics over the same time period, and I'll show you the results of that analysis in a few slides. But first, I thought it would be useful to show you this figure, which demonstrates how contraceptive use among teens visiting Title X clinics in Colorado has changed since 2008. And as you can see, LARC use rose dramatically over this period. And it appears as if it was teens who would otherwise be using oral contraceptives who were the ones who began using these LARCs. This figure here simply shows that the huge increase in LARC usage that occurred in Colorado is not something that was seen across the United States. And then this figure here shows that by 2013, Colorado was unquestionably an outlier in their teen LARC usage rates. So getting back to how we estimate the effect of the initiative on teen birth rates, a simplified version of what we do is to compare how teen birth rates changed in Colorado counties with clinics receiving funding, shown in blue, to how teen birth rates change in other U.S. counties with Title X clinics, shown in orange here, over the same time period. And that comparison is reflected in this figure here. So first, looking at the dashed line, which shows the teen birth rate outside of Colorado, we can see that teen birth rates have fallen all across the U.S. since 2009. And I think this suggests that the teen birth rate would have fallen in Colorado even without the initiative. But the fact that the teen birth rate declined by much more in Colorado counties with clinics receiving funding tells us that this initiative did cause significant reductions in the teen birth rate, and the magnitude of the gap that we see tells us just how much. And so we can make statistical adjustments for differences in trends, demographics, economic conditions, and other relevant policies. And when we do so, our estimates indicate that the initiative reduced teen birth rates by 5.6% over 4 years. Moreover, these effects were especially pronounced for counties with poverty rates above the Colorado median, which I think is pretty important when thinking about the potential for similar policies to affect teen birth rates outside of Colorado, where poverty rates tend to be higher. And also a back-of-the-envelope calculation based on these estimates suggests that this initiative prevented over 1,000 teen births that would have been conceived between 2009 and 2012. So all of this naturally raises the question, what does this mean? In my view, it means that expanding access to LARCs can lead to large reductions in teen birth rates in practice. And these numbers give us a sense of how much in this case, where it appears as if the policy largely caused teens to switch from birth control pills to LARCs. And so I think it's important to keep in mind that a policy that figures out how to reach sexually active teens who don't use any contraceptives or who use only condoms could have even larger effects than those that have been seen in Colorado. Moving forward, I think the big question is whether these impacts can be replicated. And following on with what Dr. Wolk said, on this front, it really is worth highlighting that the ACA has improved access to contraceptives, but that publicly funded clinics remain important to many teens. And I think the number of people who are still using these clinics, it serves to highlight their continued importance. Another thing I'll mention is that when thinking about the magnitude of the effects that we should expect from future efforts to expand access to LARCs, we really need to think about what the new LARC users would otherwise use. And that can tell us a lot about the magnitude of the effects that we can expect to see. The other thing, and this will be the last thing that I'll mention, is that the new IUD Loletta has made it significantly less expensive for publicly funded clinics to make LARCs available to their clients. So this type of program that was really successful in Colorado, and all the evidence points to this being a very cost-effective program, it would be even more cost-effective in today's context where LARCs can be purchased for reduced amounts. So I'll leave it there so we can get to some questions, but let me just highlight that if anyone is interested in more details on the research discussed here, they can access it at my website.